First of all, Senator, congratulations on honor getting the Mental Health Hero Award.
Thank you. I'm really touched by it.
We know how important this is to address these issues and to talk about it.
Yeah, bring it out of the shadows.
And you've sponsored some bills over your years. Let's talk about it. More recently, significant funding for mental health and substance treatment during this pandemic, which means it's been a big problem.
Yeah, this all began with the CARA bill, which was the biggest piece of recovery legislation that I think Congress ever passed, that I wrote with Senator Portman. And when we were able to get that passed on the Senate floor, that required that we put some serious money behind it, because otherwise we would have just looked hypocritical. So serious money then followed. And then we did another bill in which a lot of what I call my CARA 2.0 stuff got. And now we're working on CARA 3.0, and we've used the COVID response to provide further support for the mental health, behavioral health, and recovery communities.
Let's talk about that specific support. What does that entail?
Well, you know, mental health treatment, behavioral health treatment, and addiction treatment have all been horribly underfunded for a long time, which relates to the history of these conditions being things that people felt they needed to be ashamed of. And the end of that shame and the coming out of these conditions, you know, into the daylight, and people understanding, particularly when law enforcement engagement is required, that this is an illness, that this is, these are behaviors, often symptoms of an illness, and the appropriate treatment is medical treatment, health treatment, rather than incarceration and the punishment of the state. All of that has made for a very big transition, but the money has always lagged. The support has always lagged. In Rhode Island, if someone has a mental health crisis, they will spend 2, 3, 4 days in the Rhode Island Hospital emergency room before people can find a bed for them. And then they're lucky to get that bed. So we really need to improve our capacity, and we're beginning to do that. You can't build capacity if you won't pay for treatment. So that's the goal.
So it's great that we want to build capacity, but let's also talk about it being more equitable as well. We know that we have many underserved communities, Black and Brown patients in this state who are not being served. And let's face it, we have a shortage of Black and Brown providers.
Yeah. And when you have a shortage of available services, it's too often the case that the services that are available get taken up by people who are well off, who have excellent insurance, who have contacts and access so they can get their son or their sister into the care that is available. And people who don't have those resources are left with nowhere to turn. And that is obviously deeply, deeply unfair.
So how do we close this gap? Where do we start? I mean, funding is part of it, but we need to get these initiatives out there as well.
Yeah, funding is a huge part of it, but it's also picking up people where they have a point of contact to the system and making sure that they get brought in the right way. There's some really wonderful work going on in Rhode Island with our police departments and with the recovery community, and increasingly with the mental health community, so that when there is an incident that appears to involve an addiction issue or a mental health issue, those resources are deployed very quickly. I'm working on national legislation to support that, so that there's, you know, behavioral crisis intervention teams and behavioral crisis response centers. And at the moment, you get either taken to the jail or to the emergency room. And obviously the emergency room docs are frustrated by having these people there who aren't their proper patients, simply because we don't have a better system. So we have to build that better system so that when people touch, you know, government, they get directed to the right place, and they don't need to have advocates and fight for themselves uphill against a system that is under-resourced.
Well, let's hope we can see these changes in the next few months or years. It'll be very welcome. But once again, congratulations on being this recipient of this award, much deserved. We look forward to what you're going to do to mental health community going forward.
Yeah, well, I accept it as a down payment against a lot of further work that I still intend to do.